More help could be coming to nursing homes across the country. The National Desk Jeff Harris explains the new rule the Biden administration just finalized. Jeff.
Earlier today, Vice President Kamala Harris announced the first ever minimum staffing rule for nursing homes across the United States. But opinions are split. Some say it's what the healthcare industry needs right now, while others say they agree, but finding qualified employees could be tough.
As a nurse, as someone who's been a nurse a long time, we always put patients first.
Couldn't be coming at a worse time with regards to the labor market.
Under the new minimum staffing rule, any nursing home facility that receives Medicare and Medicaid funding must provide at least 3.48 hours of nursing care per resident per day.
So it's definitely going to be a challenge.
Included in the list of requirements is a registered nurse that must be on site at all times.
All day long and all night long and all evening long in the long-term care facility.
This new rule will be rolled out in phases. Rural areas will have more time to find additional staff, and temporary exemptions will be made for areas with workforce shortages.
So we're going to give facilities time to adapt to these policies.
But in order to make this a feasible rule, McGarry says wages need to be discussed.
There are certainly workers out there. It's just that they are choosing not to work in this industry. And that's because of the nature of the job coupled with the pay and the benefits.
And the resources available to healthcare workers should be a priority.
We need to sort of make sure that these jobs are not only lucrative for people to work in, but also rewarding.
The Biden administration also announced a rule to help improve access to home care services for elderly Americans and those with disabilities. The rule requires that at least 80% of Medicaid payments for home care services go to workers' wages. Reporting for the National Desk, I'm Jeff Harris.